Hey everyone, welcome back to Shock Doc Medical. I'm Dr. Rod. Today, I want to share some fascinating insights from a recent study that's got me thinking about both the science of hypertension and the art of conversation itself. So here's the scoop. A new global study conducted in India, where hypertension affects nearly 300 million people, shows that any combination of 3 hypertension drugs can work effectively in underserved groups. Yep, you heard that right. Whether you mix perindopril with amlodipine, pair it with indapamide, or use any of the 3 combinations, they all bring blood pressure down by about the same margin. Dr. Dorairaj Prabhakaran, a renowned cardiologist and the executive director at the Center for Chronic Disease Control in New Delhi, shared that in India, control rates are just abysmal. Only about 10 to 20% of people with high blood pressure have it under control. And this isn't just an issue for India. With over 5 million South Asians living in the United States, these findings have huge implications for how we approach hypertension in our own communities. Now let's break down what they did. In the TopSpin trial, nearly 2,000 adults were randomly assigned to take one of these 3 two-drug combinations every day. The results? A remarkable reduction in blood pressure, around 14 millimeter mercury in the doctor's office, and about 8 millimeter mercury when measured over 24 hours. About 70% of participants reached a blood pressure below 90 millimeter mercury, and more than 40% hit the even stricter target of 80 millimeter mercury. And the best part? The safety profile was excellent, with less than 3% of participants stopping the treatment due to side effects. But while the study is all about numbers and outcomes, it got me thinking about what really makes our discussions and our approach to medicine uniquely human. Human conversation, after all, isn't just a mechanical exchange of facts. It's packed with emotional nuance, empathy, and context. When I share these findings with you, it's not just to relay data. It's to connect with you on a deeper level, to understand that behind every statistic is a person, a family, facing a challenge. Think about it. In our daily conversations, we're not just swapping words. We use tone, inflection, even pauses to show care, concern, and understanding. And in medicine, that human touch can be just as critical as the treatment itself. Whether it's the gentle reassurance from a nurse, the thoughtful explanation from a doctor, or even this very podcast where we dive into complex studies, it's the human element that makes all the difference. So what can we take away from this study? For physicians, it means we have the flexibility to choose from different drug combinations based on availability, cost, and patient needs, without worrying about sacrificing efficacy. For patients, it's a reminder that lowering your blood pressure, even by a small amount, can have significant benefits in reducing the risk of heart disease, stroke, and other complications. And as we wrap up today's episode, remember that our conversations here at Shock Doc Medical are a perfect example of what makes us human. We're not just talking numbers. We're sharing insights, emotions, and a common goal: to empower you with knowledge for a healthier life. Thanks for tuning in today. If you enjoyed this deep dive into the science of hypertension and a little bit of the art behind our dialogue, please hit that subscribe button, leave a comment, and share this episode with anyone who might benefit. I'm Dr. Rod, and I'll catch you next time on Shock Doc Medical. Stay healthy, stay informed.